As weight management specialists with a physiotherapy background here at Plato Weight Management, today we wanted to address the role of the profession in helping the rising obesity rates worldwide. In the UK, for instance, it's estimated that by 2050, 1 in 2 women will be obese, with this even higher in men at 3 in 5. A study by Sack et al. In 2009 suggests that physiotherapists are not sufficiently educated to assist in weight management, as in response to a survey questionnaire including 338 physiotherapists, only 1 in 5 felt competent in helping obese individuals with weight loss. However, a systematic review by Woodenhart and Dean in 2013 advises augmenting the scope of PT education for weight control to produce superior treatment outcomes for low back pain, due to weight gain being a factor identified in its pathophysiology. So although physiotherapists are not optimally equipped with the knowledge to deal with weight currently, this might change one day. Of course, needless to say, physiotherapists can help with exercise, which is helpful. But a rule of thumb in relation to weight is that exercise should only make up about 20% of what weight loss efforts are aimed at. The real results are mainly derived from working on the other 80%, the behaviour and nutrition components. So with that said, is there anything physiotherapists can do to help with the latter, if we aren't sufficiently trained in these from a weight standpoint? Well, today we provide our thoughts on the matter. But first, as always, please take note of our disclaimer. To begin, what is even obesity? Might sound like a funny question at first thought, but in actuality, one study suggests that only about 1 in 4 women can correctly classify themselves as obese, with 1 in 14 men. When many hear the word obesity, their minds immediately jump to persons that they've seen on television, who have a BMI of 55 or so, with trouble getting out of the bed, and actually with any activity that requires movement. But that falls into the class 3 obesity classification, aka morbid obesity, which is anything above a BMI of 40. Obesity as a whole, including both class 1 and class 2 obesity, starts at a BMI of 30. So obesity is a lot smaller than the average person thinks, which is one of the reasons why many of the concerned persons aren't aware that they are. And this is a problem because if people don't know they're obese, they're then not going to be aware of their increased health risks and thus be less intrinsically motivated to change. So one way that physiotherapists can help obesity rates, which we'll be focusing on in this video, is by increasing overweight persons' awareness of their weight status. So it opens the door to discussing the related negative health risks associated. In doing so, it'll enhance many individuals' motivation to lose weight and help us steer them toward working with a dietitian or nutritionist. Now, you could say, well, can't we just leave this conversation up to the doctor? Well, the ACTION study, which involved over 3,000 patients and interviews with 600 healthcare professionals, suggests that only about 55% of obese persons report being informed on their weight status by them. That means almost 1 in 2 aren't. So there is a gap there that we can help fill. Nevertheless, one of the main obstacles for many physios to do this is that often they don't want to risk offending patients by bringing up the subject of weight, since it could cause negative reactions and lead to a breakdown in the patient-provider relationship. And to be honest, this is a reasonable concern, as it could easily happen if not done the right way. So how do we work around this? How do we inform patients they are overweight or obese in such a way that the patient will be less likely to misinterpret us as just being insulting? On a side note, if you'd like to undertake our evidence-based and results-backed personalised Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Admittedly, there's no perfect way, but the best one we've encountered is to start off by taking their height and weight. If they ask why, just say it's part of the regular intake. And to be honest, given how big of a problem obesity is and how much it relates to musculoskeletal problems, getting their BMI probably should be a part of the normal physiotherapy protocol. Anyway, whether you do it at the intake or later down the line is at your discretion, depending on the patient. And you can always just take the readings at the intake and return to it later. Next, once you have the height and weight, give them this chart and their numbers and say, okay, I want you to take a moment and show me where you fall on this chart. I've left a link to one in the description section down below. In doing so, we're letting the patient discover their weight status themselves, rather than us informing them of it. So they're not able to shoot the messenger, so to speak, and will have much more assurance we aren't trying to be insulting and that it's just what it is. Following this, when they tell you what their weight status is, if they were found to be obese or even overweight, give them a moment and ask what their thoughts are about that. Here, good eye contact, open body posture, reflective listening, affirmations, and summarization are important, and a good rule of thumb is to listen more than you're speaking. Once you hear them out, then ask them if it would be alright if you let them know what implications that has regarding their health. Asking for permission first is important, so again they'll be less likely to perceive you as merely informing just to attack them. They've enough friends and family members doing that already when they're in a bad mood, I'm sure. If they say no and they don't want to hear about the negative health consequences, then okay, just move along, maybe they come around later at some point. But if they say yeah, then inform them going by these tables derived from the literature on their increased risks concerning physical, mental, and functional health. If you'd like an additional way to work on their motivation, you can click on another one of our videos which has gone in depth on an actual exercise you can do with them. It's now in the top right hand corner of the screen. What are your thoughts on this strategy to inform overweight persons of their weight status to help increase motivation? Have you any other suggestions? We'd love to hear from you in the comment section down below. Additionally, if you're new here, make sure to like and subscribe to our channel. So that has been our video. Thanks for watching, and I'll see you next time.